I think one of the priorities this upcoming legislative session is going to be workforce. I truly think that's going to be the overall theme of this session for healthcare providers. Healthcare providers have struggled with hiring personnel for many, many years, and it's just been amplified by the pandemic. And if you take hospitals, for example, hospitals were having to essentially hire their nurses during the COVID surge from nurse staffing agencies for 3-4 times the amount per hour, and it's just not sustainable. Same thing with home care, whether it's private duty nurses providing care to fragile children in the home or community care providers. I think that's going to be really the number one issue for many healthcare providers. And I think that there's a good opportunity to address that in a meaningful way this legislative session, because it looks like we're going to have a fairly decent budget surplus. And I've been meeting with legislators talking about that issue and the need to, frankly, give rate increases to providers, because that's one of the ways that providers are able to pay for and recruit staff. Another issue that I have been working on that may or may not become an issue this legislative session is ABA therapy, that's applied behavioral analysis therapy for children with autism. It was a benefit that was funded by the legislature last legislative session, but in my opinion, it's woefully underfunded, and I think we're going to end up with an inadequate network. So I think that will be a priority. One big issue for the state of Texas, particularly for hospitals, is the Medicaid waiver. Of course, that's an issue that is at the federal level right now at CMS, and that's millions and millions of dollars, frankly, per week, per day that hospitals are losing because CMS has not continued the directed payment programs to hospitals. So there will be a discussion around that with hospitals and our state legislators and what we can do to shore up hospital financing and collaborate with the federal government in the best way that we can.